What's up, everybody? Happy Tuesday. Welcome into the Performance Medicine Show. We do this every single Tuesday night at 7 p.m. I see some of you are already here. Roel, D-Lynn, what's up? D-Lynn, thank you for being patient with me last week. And I think we had a follow-up question around that. So we'll probably talk a little bit about that topic here tonight. Bianca, what's going on? Great to see you. Great to see you in here. Happy holidays, everybody. It is December. I think this is our first show of December. It is December 6th. Welcome in to everybody. Steve, what's up, my brother? How are you? Good to see you. Lisa, thank you for sharing. Lisa shares every single week. We truly, truly appreciate all the people sharing the broadcast. So thank you, Lisa. We got some great questions. We got some really in-depth hormone questions that I'm excited to get into. We got some questions, some new types of questions, which I think will be fun. For those of you who are new to the Performance Medicine Show, the first half, we take questions that came in throughout the week. And sometimes I do miss them or I overlook them. So I'm going to try to keep my ear to what's happening on Instagram and what's happening on email to see if anybody comes in last minute with a question. Let me see here. We had a big day on the YouTube channel. As you guys know, Performance Weekly goes out every single Tuesday between 12 and 2, depending where we're at with the editing process. But the Common Sense MD was a really an important one and a big one this week. Is on influenza. Dr. Rogers talks about treatments. He talks about keeping your immune system healthy. He talks about testing. One thing I got out of this episode was the importance of testing and how, because there's a few different things going around right now. You need to know exactly what you have because that will determine the treatment. So send this to a family member. Send this to your friends. This is kind of in, I think, 16 minutes. You'll be really, really educated around what's happening this flu season. And as Dr. Rogers said in this episode, it is a doozy. It's a doozy this year. We're already seeing quite a bit of it. So it will be, I think he said it's between December and February. So the importance of keeping our immune system strong is very high in importance. And this one was such a fun one with my man, Lucas Schmidt, our nutrition coach. On this episode of Dive Into Diet, we actually go inside Lucas's kitchen and look at the spices he cooks with. We look at the appliances he uses to cook all of his meals. And I'm telling you guys, coming from somebody who cooks 0 meals, talking with somebody who cooks every meal in Lucas, it was an eye-opener for me. And we're going to put this up a few times. Holiday cooking classes are happening with Lucas Schmidt this month. The December 7th class, Sugar-Free Sweet Treats, is already sold out. That's happening tomorrow. So that's not a possibility at the moment, but we do have 2 spots left for December 14th. That class on Healthy Hearty Italian. So 2 spots left there. And then we've got 5 spots left in the December 21st holiday meal prepping class. So you'll see me put that up a couple different times. So make sure you call the Johnson City office if you want to jump in there and grab one of those last spots. And then we had my guys over at TriStar Strength and Rehab. We had Josh Davis and Zach Jackson, 2 PTs who are also certified strength trainers. We go over in this episode of Outside the Box how to stay strong over the holidays. We talk about, how do you keep your routine when you're traveling or when you're with family or kind of outside your normal. Super fun episode with my guys there. So be sure to check that out if you need some strategies over the next couple of weeks to stay strong. Who else we got in here, guys? We've had a few people come in. Hello. Welcome to the Performance Medicine Show. Thank you guys so much for hanging out with us. We're waiting on Doc. And if you want to go ahead and put your question in for Dr. Rogers, go ahead and do so in the comments. And I see Dave, what's going on, man? Great to see you. Thank you for hanging out with us tonight. Deborah, great to see you. Thank you for being with us this evening. We do this every single Tuesday at 7 p.m. So if you haven't already, tell your friends. This is where health and wellness questions are answered every single week with Dr. Rogers. We're super pumped about the show. And in particular, I'm excited about this one. I think Dad's going to have a lot of energy. If you don't know, he is my dad, as well as Dr. Rogers. Shoot. Sorry, guys. I changed my part the other week, and it's throwing me off in the mirror here. So excuse my hair. Is Doc ready to roll? He's in hair and makeup. Doc's in hair and makeup. He's in the green room. He's getting ready. It seems like I should have gone to hair and makeup, but I didn't have that option tonight. You guys might be seeing Dr. Ike tonight. We will see. It depends on his mood. You ready, Doc? All right. Let's see here. What's going on, man?
I don't have hair or makeup.
Yeah,
and I don't have a green room. I do like your part.
My part,
although it looks a little weird tonight.
I know. I feel like my hair's not doing great tonight. I'll be honest with everybody. I'm not feeling my hair. Katie, thank you. I needed that encouragement. I've been working with my part, and it's sometimes.
Why are you going on the other side? Why is your part on the other side?
Well, it was on the other side, so I switched it based on a recommendation from my hairstylist, and he said, dude, you're parting it on the wrong side, and wow. So you go with the crown, and that's what I did.
Okay, well, those are very important things. So first things first. So
I mean, especially for this show, I got my hair can't be looking. I can't be on the wrong side of the part. All right, I just hit record. For those who don't know, we record this live and we post it on our Outside the Box podcast next week. I guess this episode will go up. So shout out to all the Outside the Boxers listening over on Apple and Spotify. Doc, you ready to answer some questions, man?
Sure. Yeah. Uh-huh.
This one is one around Cognitex. Over the last couple of weeks, we've talked a lot about Cognitex. It's a life extension vitamin for brain, memory, cognition. Last week, you said the Cognitex has really helped your brain. In what way? Memory, focus, or what? This is a question around how are you using Cognitex?
Well, as you know, I have a huge brain, Ben, and always have since I was a little kid. I'm always trying to make Ben laugh, and it's hard to do because he doesn't get my jokes. But no, I do take it. It's not a miracle drug by any means, but it definitely helps those neurotransmitters work a little better. It has phosphatidylcholine, phosphatidylserine, and it just helps me be a little more alert. Hopefully you want the memory to be, your memory to be good, because when you get 68 years old, you really need all your faculties and focus. I think it does help me focus. There's a couple things I take. One is Cognitex every day. Mm-hmm. And the other one is, I like the CBD gummy called Energy. And to me, it gives me kind of a calm, focused energy. You see, there's Ike. He's wanting to get on here early tonight. He
I can be
definitely
patient.
be patient. He needs some kind of chill pill for sure.
He needs GABA.
But, he may need GABA, but yeah, I mean, I like it. Again, it's just there's a lot of brain, little substitutes and all that, and supplements you can try. And I've tried a few of them, and that one seems to work the best for me. I picked up on that through one of my conferences, and I'll never forget a neurologist that was doing a lecture, and somebody asked him if he was on a desert island, what was the one supplement that he would take over any, and he said Cognitex. I guess he'd have enough vitamin D around if he was on the desert island, because to me, vitamin D is the most important vitamin. But certainly, if you get past 50 years old, there's no doubt that you have a little neurodegeneration. Your brain's getting a little smaller, and I just think it helps. It helps me some. I'm certain of it, because I've tried on and off of it, and I just seem to be a little more alert, can remember names a little better, which I'm terrible at anyway. But so I think it helps. Helps somewhat.
It seems you're kind of using it for all of the above. Probably a little bit of short-term memory, as well as focus, alertness, things of that nature.
Right. Short-term memory. Long-term memory is easy. Short-term, as you get older, is what you need to kind of focus on. So I think it definitely helps me some. Bacopa is another one you could try. Any Bacopa extract works pretty good. Some people say ginkgo works pretty well. But if you find yourself having a little harder time comprehending what you just read, or remembering names of people that should come to you real quickly, either you're stressed, or you're not getting enough sleep, or you're getting a little bit of age on your brain. And maybe if you looked at my podcast from last week, you're drinking too much alcohol, because it really is hard on neurons. But Ben, just put on a hat. I think, Lisa, that's a great idea. Put on a hat. I think that would help.
Thank you for that, Lisa. I agree with you. I agree with you. Jasmine, I see you. Thank you for hanging out. I know you guys had a long day at the SkinCeuticals conference with the team of estheticians. Our whole team of estheticians went to a SkinCeuticals conference here in Knoxville. So thank you for being with us. I don't think you need Cognitex, Jasmine. You're
Jasmine doesn't need it. She's sharp.
No,
sharp. She's young. She's young and sharp.
Yeah. Let's see. D. Lynn saying I need some hairspray. I agree. I think this is what probably needs to happen. But Katie says
I think you need a ball cap. A ball cap is really a redneck toupee. That's what it is. So put a ball cap on.
Welcome in, everybody, to the Performance Medicine Show. This is where we answer your health and wellness questions. Let's get to the next one here. And let's see if this is an HRT question that I really want to get to, because I think it's going to help a lot of people. This is a combination question, so we'll just kind of work our way through it. Is it ever too late to start HRT? I'm 55 years old, and I've been postmenopausal for approximately 8 years now. I just had the Cleveland Heart Panel done, and it revealed that I have minimal hormones, estradiol less than 5, progesterone 0.17, and testosterone 22. And then we get into the question here. My major complaints are fatigue, weight gain, brain fog, apathy, anxiety, and depression. Is HRT what I need? And is it safe to begin this many years after menopause? And then I'll follow it up once you kind of tackle this one.
Oh, yeah, for sure. I mean, number one, you're not old. You're 55 years old. If you were 75, I would start HRT, especially with those rock bottom levels. And again, you're not treating labs, you're treating symptoms. But, a lot of people will say, I mean, even people that are very skeptical and, haven't kept up with the research, think that you should use them until age 65 or so. So definitely it's never too late in my mind, but the earlier, the better. You want to get hormones on board before you lose a lot of your bone volume. and brain volume as well. But no, you're certainly not too late to start hormone therapy. I mean, if you're 90 years old, you know, I probably wouldn't, but although I have in a couple of patients, but especially a couple of men. But that's just such a great question, and certainly you have all the symptoms of no hormones, lack of hormones. Um, I saw a lady today that was 72 years old, and she did a Cleveland, and her hormones, of course, were low because she was way past menopause. And, she really didn't have any interest in taking hormones because of that same thing that you're worried about. People used to think that it caused breast cancer. And I explained this so many times during the course of every day in my practices. Here's a couple ways to look at this. Really, it's the only way to look at it. But as your hormones decline, you decline. The average age of menopause in a woman is between 50 and 52. When you have no more periods, you usually get symptomatic with hot flashes, night sweats, weight gain, fatigue, brain fog, joint pain. It's almost like nature's way of saying that, if you're finished reproducing, start dying. And the problem is we're living too long. So if you want to live that second half of your life without hormones, you're going to get brittle. There's no doubt about it. It's kind of, is it nature's plan for you? Yeah, it's kind of, if you want to take the nature's way out, then you're going to suffer because most likely you're going to live for a long time. So if you want to live that second half of your life without hormones, you're going to suffer a lot more through osteoporosis, brain fog, less energy, more weight gain, especially around the belly. It really changes your metabolism in a bad way. So the reason a lot of people are hesitant about it is because there was a study about 15 years ago called the Women's Health Initiative. In that study, which is really a cardiovascular study, it wasn't even a hormonal study. And the average woman in this study was 17 years post-menopausal. And they had some deductions based on this huge study. And that scared everybody, doctors and patients included, off of hormone therapy. Now, here's the things you have to realize. Most of those women were 17 years postmenopausal, kind of late, and they were using Premarin and Prempro, which Premarin is made from pregnant horse urine, mare urine. And the pro part is medroxyprogesterone, which is a terrible form of progesterone. It's the one that really causes all the problems. And what they did was they came out with this study that claimed through the media that there was a 25% increase in breast cancer by using hormones. But if you look at the study really closely, and I have, and so have a lot of other experts, and it's really a crime what they did coming out and saying that because it's completely false. But first of all, when they just took the Premarin only arm of the study, and then that's pregnant horse urine estrogens. It's not identical to what a woman puts out. Even with that, using Premarin alone, there was less breast cancer. But when they used Prem Pro with a medroxyprogesterone in that, the incidence of breast cancer went from 4 women per 1,000 to 5 women per 1,000. And they claim that was a 25% increase in breast cancer using Prempro. So it was really misconstrued. Before that study, Premarin and Prempro were the top 2 prescribed medicines in the United States. So it really put a lot of women at a disadvantage in taking hormones for everything. So it was a really bogus study. And besides, they were using synthetic hormones. They weren't using bioidentical hormones, which is what most experts like me use. They come from plants, are identical to what your body made before. You have a lot lower risk of breast cancer, heart disease, dementia. If you start bioidentical hormones at your age, it's 55, your chances of getting dementia are cut in half. And that's significant because Alzheimer's dementia is a woman's disease, 4-1 over men. I mean, why don't you think women have heart attacks before age 50 like men do? Because of protective estrogen. Why don't you think that? Why do you think they get more osteoporosis than men do? They've got protective estrogen. So when that goes away, you start getting brittle. So it's a quality of life thing for one thing, but it's also a longevity thing. You're going to live better and longer. And besides that, it reminds you to get your mammogram yearly and your checkup. So, when I put a woman on hormones, I make sure she's up to date on everything. I mean, you wouldn't want to even use a bioidentical hormone if a patient already had breast cancer. So you check it out first. So no, it's not too late. I'd almost guarantee you would improve in every one of those categories. And you need to think about other things too, like eating right, exercising, getting good night's sleep, handling stress or getting rid of stress, and living your best life. I mean, those should be the best years of your life. And a lot of times women gain weight through the years because your metabolism changes. You have kids, it throws your thyroid off, it throws your adrenals off. You become more insulin resistant, you get depressed. And a lot of people don't realize women need testosterone as well as just estrogen and progesterone. Testosterone is very protective against breast cancer, and it's helpful in every other way. I mean, that's the one hormone, male or female, that really makes all the difference. So check out my podcast on using testosterone pellets in women that have had breast cancer, that you can no longer use any form of estrogen or progesterone. It decreases the risk of recurrence. Plus, it overcomes those side effects you're probably going to get from taking medicines like tamoxifen. I dealt with a lady today on that. It's a very interesting conversation with her. Her side effects were so bad with tamoxifen that she's not going to do it. I mean, and they put you on that for 5 to 10 years. It wipes all the estrogen out of your body. So you have hot flashes, night sweats, osteoporosis, increased risk of heart disease, breaking bones. And it's kind of a miserable therapy. I'm not saying you shouldn't do it because it really reduces your risk of recurrence by about 3%, average between maybe 1%, 3%, depending on which one you use. So not only will testosterone pellets help those symptoms tremendously, because this is the one hormone that works the best, it also decreases your risk of having a recurrence and having side effects from those medicines that really have a lot of side effects, like tamoxifen. So do your research, look at it. Your oncologist probably doesn't know about testosterone pellets. It's just, they're not touted because they're not made by big pharma. There's no way they're going to know about them. And of course, they're going to be skeptical about it. Us doctors are very skeptical about things we don't know about, because a lot of times we think we know everything, so, and we do things like it's been done for 30 years. But, if you really have a lot of experience in this and you see women improving on this, and you see them on a daily basis, and you do your deep dive into the research of, for example, testosterone pellets in breast cancer survivors, then you'll probably want to sign up for it. But so do your research. Certainly, I hope that answered your question. I know I'm in a long-winded soliloquy on the advantages of having bioidentical hormone replacement. To me, you're at risk if you don't do this. You almost have to fight nature in a way on this one, just like you would fight nature in a way by taking an antibiotic when you have an infection. Same thing. So just educate yourself and try it, and talk to other women who have done this. But certainly, it's not anywhere near too late for you. So start on some hormone cream. does not cause heart disease, does not cause blood clots. We don't use oral estrogens or testosterone. So in every way, you would be helped. So think about it.
And the follow-up, and this is really perfectly timed here, is how long should HRT last? And I know it varies a little bit, but how would you go about answering this sort of question
I
around?
don't know. I'm not sure what you mean by that. How
Let's-
long should you take it in your lifetime? Is that how you take that?
The way I took it was, say you get a pellet procedure and how long that lasts.
Oh,
And then the other, like if you're on creams, how long do I have to take the creams? Which, I know your answer, but for the people who haven't heard you talk a lot about hormones, why don't you go ahead and just kind of talk to
well, I
us
would
about
take it forever. I would take it as long as you live. I certainly am going to. But pellets last about 4 months, sometimes longer in women, about 6 months in men. And if you do the creams, you just keep using them. I mean, you have to use those daily. I usually like to do it 6 nights out of the week so you won't develop a little bit of a tolerance, but it's not a big deal. You're probably going to forget about it one night a week anyway. But I think with male or female, pellets are the best way to go. There's no doubt about that, in my opinion. I think I probably did 6 cases today. I did 1 man, 5 women today with pellets. I do a lot more pellets on women than men because they're tiny. It takes me about a minute to get them in. And the women that get them in, I mean, 99% of them know when their pellets are gone and come back in for more. I hardly ever see anybody go back to the cream. Occasionally, but very rarely. So I hope that answers your question.
And this is for my own personal curiosity. What's the age of the oldest? Let's go with male. Oldest male you've put on testosterone.
I did pellets on a 92-year-old pharmacist. And
Now, is he just starting?
he had done some testosterone shots, not by me, but in the distant past.
Okay.
But it really helped him. As females, certainly into their mid 80s. I've done creams. Usually by that time, I don't know why they don't want to do pellets, but they could. But certainly, and this, this is, you're not going to find this in your regular this information in your regular doctor's office, and you're not going to find it in your gyno's office either. And there are a few gynecologists that are really knowledgeable about this, but not many because they're just not taught it. And because pharmaceutical companies don't make these, it's been off patent for 50 years. There's no money in it for them. So that's what doctors tend to use. I told you a few weeks ago when one of my patients questioned their doctor on how he kept up with all the stuff in family practice. How in the world could you keep up with all this stuff? Well, you study every night. What do you do to keep up with all this stuff? And he was very honest with this answer. It's very telling. He says, the drug reps. And to me, that was a truthful answer. Sad, but true, because they're salesmen. Now, again, they have knowledge. They provide samples. And, I learn stuff from the drug reps. But unless I do my own digging and use my own common sense and clear mind, then I want to learn way more than I'm going to learn from a 5-minute encounter with a drug rep. And I have many great drug rep friends. I love them, but come on, this stuff's complex, and you can't just learn your stuff through that. Yeah. If you are, you're going to be practicing medicine in the dark ages because medicine changes so much every year. I practice nothing like I did 5 years ago. And I've been practicing 36 years. I don't use hardly anything that I did 36 years ago when I first started my practice. It's completely different.
It seems like the biggest skill is this continuous learning, this continuous thirst for learning. And like you've said plenty of times before, it's not necessarily the doctor's fault. A lot of them aren't in
No, it's not.
scenarios where
It's not.
they
No,
can.
they're like rats on a treadmill that have to churn it out. They don't have time enough to go over this stuff with you. They just don't. Unless I had a cash-based practice, there's no way I had time to. I was like every other doctor,
Yeah.
sitting on a computer staring at that while I put a bunch of numbers in and tried to get you in and out of my office in 7 minutes, which is the average visit. But I've told you this, Ben, but I'll tell the audience out there, there are 3 things that a doctor worries about in practicing medicine. 3 things. And I asked my brother about this, and he agreed with it 100%. And I've queried some other physician friends, and they say, that's exactly right. So there's 3 things that doctors are focused on in their practice. Number 1, they want to help the patient out. Hopefully. I mean, that's why they got into medicine, to help somebody out, right? So that's your number 1 objective, help somebody with their health. The number 2 objective is to make a living doing this, to make money. So you've gone through all this training, and there's a lot of stress. There's a lot of, I mean, you have people's lives on the line. They're relying on you. So, and you've trained for 12 years before you even start practicing. So you got a lot of time and money to make up for. But anyway, so the second thing, of course, is making a living doing this. Now, number 3 is avoiding a lawsuit. That's the third thing that they're worried about. So I don't really worry about that much. Knock on wood. I've never been sued in 36 years. I may get sued tomorrow, but I'm not worried about it. If I worried about that, I'd be practicing defensive medicine. I wouldn't be doing the stuff I'm doing, looking outside the box. I would be scared to, I'd be practicing medicine the way I did 30 years ago. So they're worried about lawsuits. So they've got to really stay within I better not do that. That's outside the box. It's that Tylenol is not FDA approved for, that ache you have in your toe. So that's the 3 things that doctors worry about. I hope that's a little eye-opening to you, but
It's wild.
It's the honest truth. So, but anyway.
So we're going to stick with the hormone theme here tonight. This question is, I have heard a hormone podcaster say they use estradiol cream on their face to directly help their skin. Have you heard of doing this?
Sure. Yeah. Mm-hmm. You can even put testosterone on the skin. Some of the compounders make a testosterone aftershave lotion, but certainly estrogen is great for skin, and you certainly can. I just tell people not to put it around the breast area, of course, but we use it for vaginal dryness, for all kinds of stuff, chronic UTIs and things like that. So definitely, you definitely could use it on your face. It's great for your skin. That's another reason to use hormones, because you're going to look better as well. Your hair will be better. Hair loves estrogen. It's not too fond of testosterone or DHEA, especially if the testosterone is converting to DHT. So there's ways of dealing with that if it happens. But anyway, good question. Yes,
great question there. That was one we haven't gotten on this show yet. So thank you for putting that in there. And this is one, Lucas actually touched on this a bit in our Dive Into Diet episode on supplements for performance. Any of the supplements you have taught us to take that we should not take around the same time as drinking coffee, not taken with coffee, but just at the same sitting. And in fact, that's what Lucas was talking about, was something he takes with coffee. He mentioned taking GABA with coffee as a way of having kind of that the evening
offset
out.
Yeah, that's a good idea. Yeah, that one you should take with coffee. They used to say you shouldn't take if you're on thyroid supplementation or prescription medicine, you shouldn't take it. You should just take that with a little bit of water. But actually, if you look at the research, you can actually drink your coffee with your Armour thyroid or Synthroid or whatever form you take. Black coffee will not affect the absorption of your thyroid medicine. And that's kind of new out of endocrinology, but I'm trying to think of anything that you wouldn't want to take with coffee. I don't have a lot of restrictions with it, to be honest with you. You might not want to take colostrum with coffee for your gut because the heat may affect it just a little bit. But certainly your B vitamins, which are fine to be taken on an empty stomach. I prefer that you take your fat soluble vitamins A, D, E, and K, with a meal, or especially a fatty meal. Which again, I like good fats. They're helpful for you. Never get on a low fat diet. But other specifics, not with coffee. I have to think about that a little bit as far as which ones. I'll ask Lucas. He's a real supplement expert too. So I don't worry too much about it, about that aspect of it. Your probiotic, you might not want to drink with hot coffee like your digest shield. It may affect the absorption somehow and maybe inactivate some of those pre and probiotics. But it's a really good question, though.
That is interesting. That's something I'll mention to Lucas and see if we can't do a little deeper dive into diet.
And coffee is so good for you. Unless you have a lot of arrhythmias that makes you too jittery, but coffee is great for your brain. It's one of the most potent antioxidants out there, even more potent as an antioxidant than dark chocolate. So I really like coffee. Very helpful.
I'm going to put this up from Bianca because it's a follow-up from the estradiol on skin. So should we use our normal BHRT prescription on the face or ask for straight estradiol? And who would we ask for that? So kind of a little bit more.
Well, you should go to the compounding pharmacy, but no, use your regular hormone cream, on your inner thighs for the most part. That's where I like to use it because it's more of a fatty area, distributes better. But, talk to your compounding pharmacist as about a face cream. And I'll do a little bit deeper dive on that because if you're using it on your face, again, monitor your levels and make sure that estrogen progesterone balance is good. So if I was using it on the face and the inner thigh, I'd probably tweak it a little bit, the formula on your thigh, and I'd certainly follow blood levels to look at that. But that's a great question.
Is this something they ask their provider or a compounding pharmacist around in terms of?
A compounding pharmacist. I'll get a little more information on that for you.
Okay.
Yeah, that's even when I add say you're taking a cream for your inner thigh and we want to add a little bit of vaginal estradiol. I prefer estriol for that single purpose for dryness. But I may take a little bit out of the biased cream for the inner thigh, but usually not, because you only usually have to use the estriol cream a couple times a week. So it shouldn't affect your levels too much, but I'll always follow levels and I follow symptoms. But look at that estrogen progesterone balance. They balance each other out. They're both important. Whether you have a uterus or not, you still need progesterone.
I'm trying to think of would you use it on the face just as an additive, or would you, is it for like a completely different purpose, for more like
we're talking about for skin
okay.
With that.
Got it.
Yep.
Okay.
Yep.
Thank you for that, Bianca. Pop, what do you think? St. Pete? I love St. Pete.
Man,
Jeff's down there.
Yeah. My brother-in-law lives in Tampa, and of course you fly into St. Pete. And
Lynn, we might have to. We promised Katie we wouldn't open an office in 2023, but maybe we can convince her in like 2024. I don't know.
I'd love to go to Nashville. I think Nashville's my next move. But then maybe St. Pete. I'm getting old now, 68. That'd be a good move for me.
I think that's a great move for
Wouldn't
you.
it? Yeah, it'd be a great move for me to go down there and retire,
Yeah.
but not, I'll never retire from working, but actually be in a better climate. My ultimate goal will be to go down there for the winter.
Shout out to all the Floridians in here. We love Florida. Thank you, Len, for hanging out with us this evening. All right, we got a few more questions here. Let's see. This was one kind of a follow up to one I misinterpreted from D. Len last week. This is around the shingles vaccine, and the question here is, so we'll follow up. Get the vaccine if you have had shingles. So the way I interpret it, they've had shingles before. Should they get the shingles vaccine? They're choosing no.
It's weird it's weird. Once you have shingles, in my opinion, in looking at patients, you're more likely to recur with it. A lot of people get them over and over again in the same spot, so, like I told somebody today, they felt terrible after they took their first Shingrix. It's a 2-shot thing nowadays. And a few years ago, I took one and I felt terrible too. So I didn't get the second one. So I assume that I've got some protection. But if you choose to get the shingle shot, please don't do it within 6 months of when you've had an outbreak of shingles. After that, you could take it, but I can't blame you for not doing it. I've seen some horrible cases of shingles for sure. And there is some protection with it, with the shingles vaccine. I can't talk a whole lot about vaccines, on the show. So maybe you want to get with me later on that. But certainly the shingles vaccine has its pros and it may have its cons. You may not feel very good after you've had one. But just the fact that you get shingles means that you had chickenpox when you were a kid. It never really leaves your body. It just kind of hides in a nerve root. And it can recur based on anything. Most of the time we don't know why, but sometimes stress can bring it out. A virus could bring it out. Another kind of virus. But just think about it. I don't know the exact statistics on it, but so make your own decision there. Certainly, if you don't feel comfortable with it, don't do it.
Thank you so much for that question there. And we're going to move on because I want to get to some live questions here. We got some questions flowing in. Go ahead and put those questions in the comments, guys. If you got a question for Doc, Roel, man, we'd love to be in Texas too. I love Texas. Texas forever. Friday Night Lights.
Yeah.
Have you considered working with Rife-based devices or worked with them in the past? If so, are there any you would recommend?
Yeah, if I remember right, a Rife-based device is I'm pretty sure it's an electromagnetic frequency device that they claim can treat cancer based on frequencies that can destroy bacteria, which I think that the rationale for using that was that bacteria caused cancer. And there may very well be an infectious etiology to cancer. There probably is, whether it be viral or bacterial in nature, parasitic in nature for sure. So that's a really interesting question. No, I haven't worked with one. And my gut feeling is that, it's really outside the box, but I think you can get these and buy them and use them in your house. But from everything I've heard, because I've had a couple of patients mention this to me in the distant past, and I think it's all based on this one doctor's observations decades ago. But most of the things I've read say it doesn't really work. Not that electromagnetic frequencies won't work to provide some type of healing. I think they do. And they may, in fact, be, work for some types of cancers. But the home devices, you're probably wasting your money. What I've heard is that you'd have to get totally different frequencies, and you'd have to get a lot more expensive evidence-based studies to see if it would work. And certainly the riff against it would be that you would use one of these devices if you came down with cancer and ignore the traditional treatment. I'm all for trying alternative things for cancer treatments, but first do the traditional, like get the cancer cut out. If it's a tumor, get it out. And whether or not you consent to doing some forms of chemo or radiation, that's up to you, and look at the stats on the different success rates on it. So no, I haven't worked with one. I wouldn't buy one for myself. If there was a more powerful machine that had more proof that it worked, then I may consider it. But for cancer treatments, you're kind of out on a limb out there with those things. So I hope this helped. There's not anyone that I really know about that I'd recommend at this point. Hopefully they'll come up with better electromagnetic devices that pulsed energy. I'm certainly a believer in energy therapy, for healing. But for when you have a cancer, you need to go after it with everything. And so don't rely on that machine to cure your cancer.
Great question there. Thank you for sending that in. I just got a question here on Facebook. I totally missed. I'm sorry that I missed this last week. The question's around Mounjaro, and we've been talking quite a bit around Mounjaro recently. The question is, why does my Mounjaro only seem to last about 3 days before I started having cravings and want to eat everything? I'm on 5 milligrams for about 6 weeks now. Any thoughts around this, Doc?
Yeah, you need to increase your dose. It should last almost a week. There may be other factors and other things you can do to suppress your appetite along with the Mounjaro. But it's proven to be a really good medicine. I really like it. There was an article in the Wall Street Journal yesterday about Ozempic and Mounjaro, and the bringing out of Wegovy, which is really semaglutide Ozempic marketed just for weight loss. And of course, Ozempic and Mounjaro are marketed for diabetics. They're used off-label much more frequently for weight loss and diabetes, but it's only FDA approved for diabetes. So insurances won't cover them. That's the problem with it. So Novo Nordisk, the makers of Ozempic, came out with a product named Wegovy. And it's a once a week semaglutide that works really well, and you can actually go higher on the dose than you can the Ozempic. So it really works good. The problem is it was so popular, and they promised, you only be paying $25 a month for this if you had certain types of insurance. They didn't make enough. They contracted with one service to make the stuff, and they got inspected by the FDA and couldn't make it until they cleaned up their act. So it was a massive failure on the part of that drug company to promote it so heavily and not have the means to make it. So it was an abject failure as far as a marketing ploy. I mean, it's a great medicine. It really is. It's the same thing as Ozempic, but it's approved for weight loss. You can use it in higher doses. So they got a few $1 million worth of sales out of that product when it could have already been billions of dollars. And now you can't get enough Ozempic or Mounjaro because of that screw up. They can't make enough, and now no insurance company is going to pay for it unless you're a diabetic. So it was a terrible marketing. But anyway, the makers of Mounjaro, Eli Lilly, they're going to come out with Mounjaro that's going to be probably marketed under a different name, but that will compete with Wegovy for weight loss. So it's really interesting if you look at their business model and you see it from the practitioner side, what a massive screw up that was. So go read the Wall Street Journal on this, because people are using it everywhere for weight loss, from Hollywood actors to everybody. That medicine, both of them, semaglutide, that's the drug of the decade for sure. And there's a lot of evidence that it can reverse non-alcoholic fatty liver. It definitely protects your heart and people that have heart disease. So it probably prevents it as well. And it works as a wonderful tool for diabetics. It works for just amazing for weight loss. If you've seen in many of my podcasts that we've done on this. So it's definitely the drug of the decade. But, you need to increase your dose. You can go all the way to 15 milligrams with that, but, go slowly.
How should they step upwards? Go up a milligram a week? How do you normally coach people to do
Usually, start out at 2.5, then 5, not a week, wait a month between changes, 10, 15. I go straight from
So if they're at 5, what comes after that?
10.
Okay.
That's what I would do.
All right. Hope that helps. And I'm super sorry for missing that last week. So thank you for being patient with me here. And I just got another one here on Facebook. Could you please tell me where to purchase the Cofix nasal spray discussed in today's podcast? Cofix, I know we have it in the office. Is it on Amazon as well? Is there other places?
You could probably order it through Amazon. It's in all our offices, but yeah, look on Amazon, Cofix.
Okay.
Every household should have one around. As soon as you start getting sick, which is what I do, spray up your nose and your throat.
All right, guys. So what we're going to do is we're going to jump into the comments here. If you have a question for Doc, we're going to try to get to as many people as possible. I see Barbara. I see you. Great to see you in here. Mark, I got your question here. Terry, what's up? Sue, Jack, great to see everybody. We're jumping in here. We're going to answer some questions for the Performance Medicine Show. Thank you, Katie. The PM Google, it is not in all of the offices. Kingsport is currently out. Okay, so we're out in Kingsport.
I thought we had a ton of it. But,
so
it must be. Right now is the flu season. I'm telling you, the flu is all over the place. I think we're going to have a bad flu season. I really do.
We'll keep everybody posted on that. Thank you, Katie, for putting that in there for us. Okay, let's get to some questions here. I want to start with Montana. I see you. Thank you for being in here. Okay, Lynn's question. Any advice for interstitial cystitis?
That's a toughie. That is a really toughie. That's a chronic inflammatory state of your bladder. It's very hard to treat. You're prone to a lot of UTIs and just pain and all that stuff. So, you really need to think outside the box on this one. There's a couple things that I do that are kind of outside the box that I think help this. One is methylene blue, which has so many uses, from long COVID to breathing better to having more energy to treating and preventing UTIs. It was actually the first antibiotic invented back in 1869, I believe. It's a dye. The pharmaceutical grade acts as an antibiotic, anti-parasitic, antifungal. Read about methylene blue. Try that. And also, I like low-dose naltrexone, LDN. I've had some pretty good luck with IC with that. So you have to almost think of it as kind of an autoimmune phenomena. Certainly look at your diet as well. A lot of times you'll get people on a totally different diet, perhaps carnivore, perhaps keto, and it gets better. So try those two things though. One of those two. LDN is a prescription medicine. Methylene blue you can get over the counter. We should have methylene blue in most of our offices.
And I'm just going to put this up for Lynn here. Yes, you can absolutely come in if
For
you're
sure.
visiting Kingsport. We would love to see you. Thank you for putting that in there. Let's get to Mark's question, because it really has a lot to do with the podcast episode today on the Common Sense MD. We're seeing a severe cold and flu season. Hospitals are beyond full. ER wait times are measured in an hour. There are shortages of amoxicillin and Tamiflu in the midst of infections. Question is, what are your suggestions for a personal armamentarium for dealing with the different illnesses from home? You just mentioned one in Cofix.
Great.
What's your, let's go ahead and just name all of them for the people here that want to find it just in one place.
Well, certainly have your vitamin C. You have a lot of vitamin C around. Have vitamin D. You're going to be taking 50,000 of D a day for 5 days. When you get sick, you're going to be taking a gram of vitamin C every hour until you feel better. And certainly take zinc, 50 to 75 milligrams. Always keep those in your house. And, there's a lot of other things you can take. But one thing, you do need a home medical kit. As I've told many people, always keep a Z-Pack around your house, maybe some doxycycline. Now, I give people prescriptions all the time for home use for when they determine they need to use it. I'm not like most doctors. Oh, let's see and all this. Have you? No, you should have it there. Save you an ER visit, maybe. But the other things you should have, you have to figure. I'd have some Tamiflu or Zofluza. Zofluza is a one-time pill only. It's really good. You really need to hit it within 2 days. Tamiflu maybe within the first 5 days, but works better within the first 2. So you need something for flu, and if you read protocols for other viruses, you can read those and have your medicine stored away from that, which I won't mention. But you should also have some Zofran for nausea and vomiting around your house. You should maybe keep some methylene blue around the house. Keep some Imodium, that's over the counter, around the house. And one thing that I talked about during the podcast today is there are home kits, home nasal swabs, to see whether it is going to be RSV, influenza, or COVID-19. You can swab your own nose, FedEx it immediately out, and within 1 to 2 days, you're going to have your answer of when they receive it. A better way to do it, so you may want to purchase some of these at your local pharmacy, or order it off of Prime. I got a handout today from Amazon. You can get your medicines through Prime. Apparently you can get them 80% off if you belong to Prime, like I do. I do it because I can watch the movies, but you pay an annual fee, and it's a great deal on a lot of stuff. But they actually have pharmacies. You can get 80% off of your brand and generic prescriptions. I don't know how it compares with GoodRx, but I think it's going to be a major player in the pharmaceutical game. I really do. I guess they believe in what I do. You should be prepared, because you don't want to end up in the hospital, especially right now with everything going around and the wait times and it's tough. You need to reserve the ER for use that people really need it. But anyway, what else would I have around there? I would have a kit maybe, but here's what I was going to say. You can go a lot of pharmacies, and there's one here in our town, Markham's, I don't mind saying it, where you can, I sent a guy there today where you can drive your car in there, and in the parking lot, you call them, they'll come out to your car, swab your nose, and it's called a fourplex test. And they can tell you if it's type A or B flu, RSV, or COVID-19 in about 20 to 30 minutes. And then you call our office with the results, or they will, or you will, and we'll treat you over the phone. So that's a great little tool. I hope a lot of pharmacies start doing this. And it's the same test you get in an ER or an urgent care center. And you do it drive-in, without having to go make an official visit and wait hours to get in around all those other sick people. So I think that's going to be a really big thing this winter. So hopefully find out somebody that does that near where you are. Do you like, I always pronounce it wrong, Ociliocinium?
I'm putting this up from D because you mentioned it in the podcast today. And I kind of want to hear your thoughts. Is this something that people should consider?
Yeah, I mean, a lot of people, that's another thing that I should have mentioned to keep around your house. It's a homeopathic medication. It's not expensive. And, if you look at the stats, it works about 50% of the time. But it's a homeopathic medicine, which actually homeopathy, most doctors are not going to know what that is, but they think it's, witchcraft or whatever, or just worthless. But actually it does have some uses. But homeopathic medicines, the theory is they take something that's actually, like in that case, it is the flu virus, that a tiny bit of it can be harbored in wild duck heart and liver. And so what they do is they isolate this and they dilute it so many times that you can't actually measure it as being in there. That's how they get by with using it as an over-the-counter preparation. So supposedly the energy from this compound is still in that extraction. But I have a lot of people that really like it if used early. What you do on that, it comes in these little pellets. I've never used it, but it comes in this little tube, and it comes in pellets that you put on top of your tongue. Don't touch the pellets, just from the tube right on the top of your tongue, it dissolves. And you can do that up to 3 times a day, I believe. If in one day you're better, that's all you need is one day if you get it early, but you could use it up to 3 days. But so I'm not against it at all. I think it may work in a lot of cases. So maybe something else, especially if you don't like taking prescription medicines, definitely have that on hand.
Thank you for that comment, D. Let's see here. Katie's saying methylene blue is in the Kingsport office, but also available on Amazon for those interested in methylene blue. Motaz, thank you for watching the flu episode today. Thank you so much, man.
I hope you don't get the flu, Motaz. But if you do, you know what to do.
Steve's got a great comment here. I keep dragon's blood in my medicine cabinet, great all around adaptogen, drops in water, but excellent on wounds, especially in the mouth. Thank you for that. That's a good, good tip there.
I don't know where you get the dragon's blood, but that sounds like a pretty dangerous thing to try to go extract.
Steve's a tough dude. That dude's a tough
dude. Steve is tough.
He's
I don't know if I've seen many tougher.
Steve, if you have a brand you like, go ahead and put that in for us.
Thank you, Steve.
Thank you for that. Just got another one come in through Messenger. Any suggestions for lungs? I've had bronchitis. My lungs are hurting and burning, and the cough is terrible. What's your thoughts around keeping your lungs healthy during bronchitis?
Well, while you have bronchitis, if you're coughing up yellow stuff, I'd use a Z-Pack. I'd use an antibiotic. And I would also pop my doses of the vitamins up. I would use the Cofix in my throat and nose. And I would use methylene blue. It's great for your lungs. And there's a lot of other stuff you can do, like, nebulized Pulmicort. Watch your O2 sats. You don't want to let your lungs get too bad. You don't want to develop into pneumonia. Some people believe in nebulized hydrogen peroxide. Some people swear by it. So look that up. I'm certainly not against it. As long as you do it right, you got to have the right concentrations of pharmaceutical grade hydrogen peroxide. So you could try that. A lot of people really swear by that. But keep an eye on your O2 sats and make sure that they don't drop. I'm not against inhalers to open it up. There's Steve, Rainforest Pharmacy.
Sangre de Drago. Sangre de Drago. Thank you for putting that in there, Steve. So this is an adaptogen, drops in water, but excellent in wounds, especially. Cool. Thank you for putting
If that works for canker sores. I'd be interested to see if that works for canker sores.
That'd be interesting. D saying elderberry as well as something to have in the cabinet.
Okay. Yeah, great. I meant to say that. Yeah.
That's another great one. Cool. All right, guys. Well, I think is Dr. Ike around?
He's right here. Ike, come here, Ike. Come here. He just got a haircut today and groomed. He looks really good.
Look at you.
Have you seen him, Ben, since he got?
No, I haven't.
Look how beautiful
look smaller.
He feels smaller.
You look smaller, man.
He's soft. I'll tell you that much.
I love that.
He came in the office today.
Oh, did he?
To greet everybody. Right after he got his groomed, he came in the office today and mingled a little bit, and everybody loved it.
Everybody, Steve loves Ike. Everybody loves Ike. We're glad to see him in here.
I got real mad at Ike last night.
You did?
Yeah, I got really mad at him.
How can you get mad? Misty's saying it's an adorable. Ike's so adorable.
He is adorable, but and here's a mug I got at the Crazy Mug Exchange.
There you go. There's Dr. Ike right there
at our party.
I wonder.
But anyway, I got mad at him last night because it was 11:30 at night, and had rained all night. So he needed to go out, before bedtime. Need to go out and use the bathroom. So I actually put my rain jacket on. He wouldn't go. Usually just runs outside when you open the door, but he would not go outside. So I got my umbrella, my rain jacket, and escorted him outside, with a treat, kind of lured him out with a treat, thinking he would, pee. So I stood out there for 15 minutes with the pouring rain with an umbrella, and he just stands right out there and won't do a thing. So I got kind of mad at him and only gave him half his treat. So I really denied him. But anyway.
Ike's hard to get mad at. D-Lin would look past it.
I felt bad about it, but, I didn't do anything except withhold half his treat.
So this is a question that I know a lot of us are thinking. Did you make the bread?
I've got my starter all ready. I've been feeding it. Tonight, Barbara, is the night that I actually start putting it up. I want to make my first attempts tonight, which I have to let it kind of, I guess you call it ferment or whatever. I have to really get it going. And I know Jenny's really going to help me on this. She's been instrumental in helping me with not only with all these podcasts and all the work she does with the thumbnails, but she's actually going to help me with this sourdough. She's taken the brunt of it with the correspondence with Steve and all. So I want to give her credit for that. So tonight we're going to be preparing the first steps and it'll rise over the night. So tomorrow's the biggie. We actually bake it and all, because you have to let it sit overnight. So it's kind of a big night tonight. Tomorrow will be the big night though. And I can't wait to taste it. And here's another thing I got mad at Ike for the other day. Steve brought me a loaf of his fresh sourdough bread, which was amazing. I put a little bit of my raw, fresh, local honey on it, sliced the part off and ate it. It was wonderful. And so I go down to the basement to practice guitar, and here Ike comes running down the stairs with the whole rest of the loaf in his mouth. So he had jumped up on the counter and gotten the whole rest of your loaf, Steve. So I actually got one piece out of that.
Ike.
I know.
Real quick, let's get this for Lynn. Do we have a brand of methylene blue that you like? I think we have a link somewhere.
I have to ask if it's upstairs, maybe Jenny will go get it. If not, Katie can.
I have the link somewhere. There is one on Amazon that I know that we're. Let's see if I can find it here.
And here's how to use it. You put 8 drops in a glass of water.
Okay, Katie put it in, and I'm looking at it right now. I'm looking at Katie. I'm looking at BPH methylene blue 1% USP grade. Is that right?
Why don't you just flip it up there? Is there a picture of it, or that Katie can put on there?
This is what I'm looking at right now. Lynn, does that help? Is that right, Katie?
Yeah, looks right.
Okay. I think it looks like BPH. Okay, BPH methylene blue 1% USP grade. Rachel, what's going on? It's been forever since I've seen you. So been an hour. Rachel is in our Fountain City location. Shout out to the Fountain City office. She's the first person you'll see if you walk in there. So shout out to Rachel. Thank you for hanging out with us tonight. And I will see you tomorrow. Okay. Thank you. Katie confirmed that is it, Lynn. It is BPH methylene blue. I'll put this up one more time for those who can't see. And that's on Amazon right there. And that is the methylene blue we've been talking about. Get a lot of questions around that. Thank you for that. Cool. All right. We calling it a show?
I guess so, Ben. Go work on your hair. Go get a blow dryer. Maybe that'd help.
All right. I'm turning the podcaster off. Guys, thank y'all so much for doing this with us tonight. We do this every single Tuesday, 7 p.m. The Performance Medicine Show. We answer your health and wellness questions. To all of you, you guys who are with us live, thank you so much for being with us this whole hour. Doc, thanks for the time, man.
Thanks, Ben. I hope you have a great night and get some rest.
All right. Thank you, guys. Thank you, guys. I see y'all. I love all you guys. Love all of you. I'm going to get my outro here. Shout out to the team who's with us. I see Jasmine, Montana, Katie, of course, is with us. Rachel. If I'm missing somebody, I'm sorry. Thank you guys so much for being with us tonight on the Performance Medicine Show. And my outro, Bob, love you, man. I'll see you next time.
Good night.
All right. See you guys.
Don't go away.